Welcome to another edition of Ed Talks. I am with Dr. Kissinger Goldman. Dr. Goldman, welcome to Ed Talks.
Thank you so much for having me.
Like, you got the coolest name. Tell us a little bit about your name.
So, I was born in 75, and my dad was a big fan of Henry Kissinger, was the Secretary of State under Nixon. So he named me after Henry Kissinger.
That's pretty cool. Have you ever met another Kissinger anywhere in your world travels?
Never, never. I'd like to think that I'm unique. I'd like to think that, even though I'm sure I'm not.
That is the coolest name. Tell us a little bit more about yourself. Like, where were you born, and how you got to Florida?
Sure. I was born and raised in Haiti. I lived there till I was 18, finished high school there, then moved to New York City, and lived there with my mom and my siblings. I did my undergrad at Brooklyn College. After graduating Brooklyn College, I thought I wanted to get a PhD in immunology. So I went to the NIH for a bit and moved to Maryland. Realized then that bench work was not for me. So applied to medical school. I did my medical school and business school in Philadelphia. Met my wife there 25 years ago. And upon graduating medical school, we needed to make a decision as to where to move. So I knew I didn't want to move back to New York City. And my wife's mom was in the process of moving to Florida. So my wife said, let's move to Florida. And believe it or not, this Haitian boy did not want to move to Florida because that Haitian boy had gotten used to the seasons. I
Yeah.
love the fall, I love the winter, but that quickly changed that that first winter in Florida in December in shorts. I said, okay, I'm
Yeah.
sold. I'm sold. So I ended up doing my residency at Mount Sinai, at Miami Beach, and I've been working with the Memorial Healthcare System in Team Health for the past 16 years or so. So, yeah, so
Yeah,
that's
that's
my
great.
story. Yeah.
Yeah, emergency medicine. And you've written one book. You've got another book in the background, kind of percolating back there. But I want to talk
Yeah.
about your book on effective patient communication.
Yes,
Tell us
sir.
a little- yeah, tell us a little bit about it.
The way I view the book is it's a recipe for healthcare providers who are either in training or out of training on how to effectively communicate with patients and their families, whether it is in the hospital setting or in the office outpatient setting. And the reason why the book came about is I realized through my work that I was essentially teaching doctors, nurses, and nurse practitioners things that they should have learned many years ago in their training, whether it's at the medical school level or at the residency level. So that's why how the book came about, because I think it was 11 years ago, I was asked to become the director of patient experience for our emergency room. So Memorial has 6 hospitals and multiple urgent cares and standalone emergency rooms. Back then, our satisfaction scores were terrible. And for some reason, I was asked to become the director of customer service. I think it had to do with my background. I had done some marketing in the past. I was picked. And since me being the director of customer service for our system, our satisfaction scores have gotten significantly better. We've gotten a number of awards from Press Ganey, and our labor force, our staff is happier. So overall, I think we've done well to the point where the company I work for, Team Health, asked me to become the director of customer service for the Southeast division of the company, which I did for a year or so, traveling to different ERs and training nurses, doctors, and try to replicate, in fact, did replicate what I did at Memorial for many other healthcare systems. But I got tired of it because I didn't want to travel so much because at the time we had younger kids and I wanted to be there for them. But as time went by, after I stopped doing all that traveling, I realized that I needed to do something to put all that information into in a way that where it can easily be used by other folks.
Yes.
So that's how the book came about. In fact, I also have a website. I created an online training derived from the book where one person or a healthcare system or a a nursing program or a medical school program can train their medical students or nursing students using that online course or online application.
Love it. Kissinger, you're the best person to write such a book because obviously this is what you do on a daily basis. And the fact that, you were able to do this and then create the website and then share it with other people, improve the satisfaction scores. I think we're gonna have to have you back again one day and we just talk about that whole experience about how people, in addition to getting the book and taking advantage of the training, can really improve patient satisfaction and patient experience because again you're a great person to be leading that charge. So thank you so much for sharing with us. We'll be sure to put all that information in the show notes so people can get to the website, get to the book, and I look forward to having you back again on Ed Talks.